We have three great presenters here today. HPD is very happy to be greatly involved in the whole iPad initiative. We want to show you what's already going on in a lot of our schools. This is not all by any means. I do want to remind you that on the 23rd of this month, there will be another luncheon in here. Nothing else come for the food. But the librarians from HPD Library will be presenting some tips and tricks and apps and that sort of thing specific that you might want to use in class. So come back on the 23rd. We'll be sending out that announcement. There are sign-up sheets, I think, on the tables. If you didn't sign when you came in, please do so before you leave. Okay, I'm going to turn it over to Dr. Hasty and the residents from Palmetto General.
Excellent. Thank you. So, I'm really excited about being here, and part of the reason why I'm so excited is because I truly believe that these mobile devices are going to revolutionize medical education, health professional education. And we've only scratched the surface. I mean, we're in our infancy with these things, and I'm really excited. So I'll tell you some of the fun stuff we're doing at Palmetto, and hopefully it will help you folks in your programs as well. You know, for those of you who don't know me, my name is Dr. Robert Hasty. I'm the Program Director at Palmetto General Hospital Internal Medicine Residency. I'm a full-time faculty member of NSU CDM, and I have been, I think next month will make my 7th year anniversary, so I've been here for a while. And about 4 years ago, I started internal medicine residency at Palmetto General Hospital. For those of you who don't know about Palmetto General Hospital, it's in Hialeah. This is a hospital. It's one of our flagship hospitals to the College of Osteopathic Medicine. It's been a great partner with the Health Professions Division for approximately 20 years, a very stable partner. It's a busy, busy hospital in Hialeah. It's 316 beds, but it feels like a lot more. Every single bed's always full, and it's a great hospital. This is the map. It's only 28 minutes away. People think it's like really far away. Hialeah is pretty close. 28 minutes down 75 to 26. I put a map of this because some people, are not sure that Hialeah is actually located in the United States, but it really is. And this is a statistic that I like to talk about for people that don't know about Hialeah. It is the most Spanish-speaking community in the entire United States. According to the 2000 census, it had 92% of the homes in Hialeah speak Spanish. And as 2010 came out, we actually got displaced. We're no longer the #1 most Spanish-speaking community in the United States. Hialeah Gardens is the #1. Hialeah is now #2, and we actually serve both communities equally. So we are the most Spanish-speaking community in the United States, and it really does create some major interesting issues with our house officers, who 58% don't speak Spanish coming in. And I'll tell you how that relates to iPads. So this is our residency program. I'm at 27 residents now. Next year I'm going to 38 residents, and I'll eventually go up to 54 residents. We got a number of spots through the Affordable Care Act. We actually got 36 additional funded spots through the Affordable Care Act. We actually happen to be the most number of spots of any osteopathic program in the United States through the Affordable Care Act for redistribution. This is our family practice residency. I see a couple of alumni from that program in this room right now. And we have a podiatry residency. We have an affiliated residency there. It's a 3-year podiatric medical and surgical residency. And we have a cardiology fellowship. And July 1st, we're starting a osteopathic critical care fellowship. And so I tell you that because, we've had some issues over the years. So here are some of the issues. Yes, sir.
Yeah, Dr. Hasty, real quick, if you can say it real quick. I see that you're changing your slides with your iPad. Can you let us know at some point what you're using for that?
Yes, I don't want to take the steam away from the future speaker, but I'm wireless right now. We're using an Apple TV, $99 product, and I'm just wirelessly sending it over, and it was one click of a button to send it over. That's what we did. And I have the full screen right here. So you talk about seeing the screen in front of you, walking around wirelessly. This is the way to present. This is the future. So anyway, so here are some of the challenges that we had prior to for this implementation of our iPads. This hospital was designed over 40 years ago. We actually celebrated our 40th anniversary last year. And 40 years ago, when they designed this hospital at Palmetto, they didn't think of it, computers were going to be such an issue. So they didn't design the nursing stations to have computers at every nursing station. They didn't design the nursing stations to accommodate, all the residents and students. We have on average like 80 trainees there every single month. I mean, it's a huge number of trainees. And you can just imagine some of the congestion that we get around some of the nursing stations because of this design situation that we have. And so we were getting situations where the residents, medical students, fellows on a daily basis were being accused of stealing all the computer space. And people were fighting for the space around the computers. And so that was one of the issues going into it. We also have a brand new electronic health record system at Palmetto. It's an excellent electronic health record system. It's a Cerner product, which is actually the #1 hospital product in the United States, according to some of the last data I had. And it's an excellent product. And of course, we come from a culture that a lot of the docs there, we're not used to electronic health records. And the residents and fellows and trainees are basically, part of the folks that are pushing along this technology. So we had that coming into play. The hospital implemented a Wi-Fi, just like almost every hospital in the United States has. They have a guest Wi-Fi for every person in the hospital. So anybody can sign on to a guest Wi-Fi. It's kind of standard at most hospitals, but not every institution has that. And then there's like a private Wi-Fi, and we can talk about some of the issues with that. And then we just weren't utilizing the HPD library like we should have. I mean, it's unbelievable. We probably have the best medical library in the entire world online. I mean, it's awesome. The ability to watch a procedure right before you do it. The ability to access live information from almost every major journal and database in the entire world at bedside. We have that technology. Yet our students and residents weren't getting there. We actually have a policy in the hospital that most computers are blocked from the free internet sites. And the reason why is because it was negatively impacting patient care. There's a potential to negatively impact patient care. People were going on Facebook and travel things when they should be taking care of patients. Yet the problem is that they blocked our residents and trainees from accessing very, very important information that was improving their education and the care of the patients. So we had that issue going on. And then we have a Dell house. And when I say we have a Dell house, you probably know that that Pro Systems was bought out by Dell, I think a number of years ago, and the hospital has a contract with Pro Systems, which is now Dell, and so we have this new technology here that's not available through Dell, and so we knew that was going to be an issue going in. So we looked at the tablet market share, and if you actually look at the tablet market share, we said, okay, maybe we'll consider one of these other products like Android. I mean, if you look at it, it's like 500,000 iOS applications out there. Every major medical application is available on the iOS. Plus, it has a pull factor. If we went with some other type of tablet, our residents would not perceive that as a cool thing. So we said there was only one choice. So that's why we went with the iPad. And this is a library symposium type of thing. I want to tell you a great book to read relating to healthcare. It's called The Dance of Legislations. Many of you I know probably have already read this. If you haven't read it, awesome book. Check it out from our library. And this essentially talks about how the National Health Service Corps went through legislation back in the 1970s. And for those of you that know how policies made and health legislation is made, it goes through a very complicated dance. And there's like a million issues that goes into getting anything passed ever. And it's a little bit like getting technology adopted in a major institution. You start off with one idea, and things kind of change around, and sometimes you might end up with a different product or a different venue than you really started. And so we had a little bit of a dance, but it worked out pretty good. So here's our dance. So the first one, we had to get IT to buy in. So here you have someone that's employed by Dell, convincing them that we needed iPads for our trainees to improve the patient care. So a couple things. First of all, they sent us their proposals. It was going to cost us $2,000 for their product per person. Now, we have 55 trainees. We don't have $110,000, right? It's a lot of money. So I think that settled some of the things. And we also were able to budget in the IT director for an iPad, because he needs to be able to know how to do it for the residents and fellows. I can tell you, he's one of the biggest fans of it now. The money. Money's tough. These devices cost $500 each. So what we did, we actually have an account where we've been segregating for a number of years, and we hadn't really used the account as some extra money that comes in from some of the services that we do for medical students that comes in graduate medical education. We had a protected account. We just had like $30,000 sitting there. Actually, we had a little bit more. So we spent our $32,000 on this. So that was an easy solution. We just had to talk the CEO into it, and we said, oh, well, it's going to help out with some of the nurse station congestion. She said, sure, go for it. We did a user planning committee, and I think that we have a few of those folks there, Dr. Sittler, Dr. Toscano, Dr. Samuel, Dr. McGuire here. Dr. Jones is on night, so he's not here right now. But this was critical. You got to involve the user whenever you do stuff like this. And because they were involved, they saw it from the trainee's perspective, and they were able to be the biggest champions of getting the iPads in at Palmetto. And if we hadn't done that, it would have been a disaster. It would have been us pushing technology down trainees, and it would have been a disaster like some of the other programs out there have done it. People said, oh, well, there's hygiene concerns with devices, right? We're taking care of patients at bedside. Well, the statistic is 80% of physicians, attending physicians in the United States, use smartphones. How many people in this room use smartphones? Right? Like everybody, right? Well, it's just like every device. Your pager, your smartphone, your stethoscope. You got to clean things, right? You don't touch the patient and then touch your device. You don't touch the patient and then touch your pager. You go back and wash your hands. This is no different than any other device that you have on you. You don't touch the patient and then touch this device. You wash your hands first. You follow the CDC guidelines. Also, for those people that want to totally sanitize it, you can buy a product called Frog Skin. They're reusable, cost $10. I'm sure that many of you have probably seen these before. You put it on the iPad, you can dip it in a gallon of bleach. I mean, it's completely, pretty much completely waterproof. It's pretty good. That's called Frog Skin. So I think we eliminated that concern. And I say probably one of the biggest things that really helped us out is we involved the NSU HPD librarians. And they were there for us. They helped us. They gave us their experience. I mean, they've been thinking about things like this backwards and forwards, applications for trainees, deployment issues, things that we never even thought about. And they worked with our resident user group with us, and they were fantastic. They were there when they were handed out. They were training the residents and fellows that day. Amanda was down there, helping out the trainees, and I mean, it was fantastic. It was awesome. So I can tell you, this is Dr. John. He's not here. He's working nights right now. His face is like every trainee that day. I mean, the morale was like through the roof. I mean, Dr. Sizemore, she's real happy. Some of our other trainees. I mean, it was like Christmas. In fact, it was right before the holidays. Dr. Morgenstein, he's actually the longest standing director of medical education in the entire United States. He's there, and he told me afterwards that was one of the highlights of his career. That's how happy the trainees were about getting these great things. And he was wearing a little Santa Claus hat because it's close to Christmas there. That was cool. So this is how they're using it, right? Electronic health records. We have this electronic health records. This is the main way. They're using actually a Cerner product. There's a native Cerner app that's out there that they're working on getting the server set up for that. So